think they criminalize addiction. I think addiction isn't looked at as a disability or a problem. I think it's just criminalized. Due to like trauma and stuff that I went through when I was a kid, as a child, it was the answer I was looking for. Most opiate addicts at some point resort to crime. At some point, and they're addicts who have to turn to crime to fuel their habit. They're not criminals who are addicted to drugs. They're addicts that's committing a crime. They're not criminals. Prison, you're punished if you relapse. Your family's taken away. Financially, they take money from you. They say it's a security. It's used for security or for, other things. You're disciplined. You can't punish drug addiction. Can't be punished. It comes down to the probation officers. It all comes down to who's educated enough in the field of drug addiction to actually work with drug addicts. It's kind of hard to work with reintegration. A lot of jails don't have reintegration, or prisons. Or if they do, it's usually like one person among, 800 inmates, 1,000 inmates. Minimum pre-release. You have to go, you have to get a job, you have to, reintegrate back into society. Other countries do it. For some reason, Massachusetts doesn't. It's kind of asking, should medication be offered for cancer patients? Yes, it should. I mean, it's if drug addiction is a diagnosis, why isn't it being treated? If a normal person knows he's going to go to jail for 10 years and he chooses to do heroin, and knowing the consequences, that there is obviously a mental health issue. It is obviously there is an issue. Perfect example is the one person I'm talking about right now. Him and another guy left. One guy took the Vivitrol shot. He's still alive to this day. The other guy didn't. He's dead. Had cellmates who have left and died the same day. Literally, there's people I was in a cell with for 5-6 months. They left, and on the same day they died. When people are incarcerated, they don't have any treatment. They get being released. The first thing that they do is they want to do drugs, and they do it. And if they live, which, as statistics say, a large amount don't live, then they have to report to probation. If they have a dirty urine, they're not going to report. They may seek treatment, but then again, they're afraid that the probation is going to violate them for using drugs. I mean, it's kept me going for years. I think when you ask yourself the question is, when a guy does this, or he knows he has 10 years over his head, and if he does drugs, he's going to go to prison. Well, obviously there is an issue. The current programs, I heard now that they've changed programs into like a harm reduction, which is a start, because before it was like, oh, hey, did you relapse? All right, now you're kicked out of the program. Now you're onto the streets with an opiate epidemic in which, there's about a probably 50% chance that you're going to die, simply because. And again, that goes to punishment, punishment, punishment. That's all society wants to do is punish.